Welcome to Upticks with Jake Falcon, founder and CEO of Falcon Wealth Advisors. In this podcast, we help high net worth individuals overcome financial complexities. We do this by enhancing financial literacy and discussing topics in a language free from industry jargon. Join us as we help explain exactly what having a solid financial plan means, as Jake draws from years of experience in helping hundreds of individuals get financially organized and focused on their goals. We hope you find Upticks educational, entertaining, and shareable. Now, on to the show.
Welcome back to the show. This is episode 239, Health Insurance with Caprice Black. Caprice, thank you for joining us on another episode of Upticks.
Thank you for inviting me back again. It's always a pleasure.
Yes. And we are recording this, and you are at your new location, which is sunny North Carolina. So how's that been?
I love being near the coast, to be honest. Weather, didn't miss winter, and we're settling in, so it's working out well. Thank you.
Yeah, that's awesome. And I don't want our clients to be alarmed. You obviously still can work with clients. Are you licensed all over the country or just several states, or how does that work?
Primarily, my business is Kansas and Missouri. I started insurance back in 2011, so that's primarily my market. I am licensed in 22 states across the country. So I work nationwide.
Awesome.
I'm an independent broker, so I contract with many different carriers, and I help individuals under 65 as well as over 65. I do keep an office in Overland Park, where I'm there about 3 months of the year, and the rest of the year I work remotely. So
perfect. Good for you. What a great way into. And we don't want you to retire anytime soon, but kind of
plans.
Right. We certainly don't want you to retire, but it's awesome that in today's world, people are more comfortable with Zoom, certainly. And so I'm sure you do a lot of phone, Zoom meetings. And then again, you've got a local office in Kansas for people that live in Kansas and Missouri. And it's been a lot of fun. Again, we refer, many of our clients to you. And just as a full disclosure, you and I don't have any type of business relationship. So we're not getting any kickbacks from each other. You're just someone that we've kind of vetted out, and we appreciate you giving an independent viewpoint on the wonderful world of Medicare and health insurance. And so just like we refer our business to accountants and to attorneys for trusts and wills, we also refer out the health insurance. We kind of serve as the quarterback with our clients from a wealth management standpoint, and we want to bring in other professionals where they have a niche and a market and a focus that we don't. We're really focused on the planning, whether that's retirement, financial, and tax, as well as the investments directly. And we let you cover the health insurance. So again, thank you for joining us in today's episode. For today's show, I wanted to talk about both sides of it. So I wanted to talk about our clients that are retiring in their 50s and early 60s and what they should look out for regarding health insurance. And then I also want to talk about our clients that are 65 and older and their Medicare piece of it. But before we dive in, Caprice, again, I want to thank our viewership. We continue to grow on a subscriber count. So if you haven't already subscribed on your favorite podcast platform or on YouTube, please feel free to do so. Also, if you think our show is any good, a thumbs up or a 5-star rating is greatly appreciated. Okay, good. Cory, you want to chime in? I know I always kind of dominate these with the talking. Cory, you got anything to say before we dive in?
Let's get going. I give the show a thumbs up, double thumbs up.
All right. So Caprice, many of our clients at Falcon Wealth Advisors are very fortunate in that they can retire in their early 50s, mid 50s, and early 60s. And so one of the common questions that we get is, Jake, Cory, what am I supposed to do about health insurance? So maybe you can kind of give a little introduction onto what you talk to your clients about as they're facing retirement in their 50s.
Would love to. Just to let you know, I'm a consultant. I advise my clients or your referrals. There's no cost to them, so it's all free. My goal is to make sure that your clients are getting the best coverage possible for their particular needs and in the best option for their needs. So yes, one of the most common questions that I get is, what are my insurance options if I retire? Because it's a big concern for a lot of people. The marketplace has changed since the Affordable Care Act. So there's a lot more choice for individuals especially those individuals who have some health conditions that they're concerned about having coverage. So just this week, 2 clients had called. Both of them are retiring. They're trying to decide whether they go on Cobra or they look at their other options. So I always tell my clients that the first option, if they are retiring, look at their Cobra package. You have 60 days to decide whether you accept a Cobra package if you retire. The Cobra plan is the plan that you have through your employer, except you're paying full amount for it with a little bit of increase in administrative cost. But that's always the first option they should be looking at, seeing
Right,
what it's
and
going to cost them.
right, and to
Right?
chime in, so Cobra again is a government deal, so everybody should have access to this, and it normally lasts about 18 months, right?
It does last for about
Okay.
18 months.
Okay, yeah, please continue. This is good.
So then the second option, the option that you choose is going to depend on your healthcare needs. The next option I'd have clients consider is the plans through healthcare.gov. Now in Kansas and Missouri, those plans are purchased through healthcare.gov, which is a federal marketplace. Those plans are Affordable Care Act compliant. That means they are going to cover all pre-existing conditions, as well as there's 10 different essential benefit categories that they have to cover: prescriptions, behavioral health, ambulance, etc. Those plans can be affordable, especially if you do qualify for advanced tax credits. That means it's a subsidy that the government provides that family to help reduce the premium of the plan. And those advanced tax credits are based on the estimated income for that current calendar year. There's no look back. It's for the year that you're in. So if you're retiring now, you look at your income that you've made from year to date, January to now, and then do you plan to get unemployment? Are you getting a bonus? Are you going to do start collecting Social Security benefits? All of that comes into the calculation of what you estimate your adjusted gross income for the current calendar year. Today, there's no caps on your out-of-pocket no caps on your adjusted gross income. It's just a percentage of that income. So if you retire, you definitely want to look at it. So I had a couple the other day. He just retired from Cerner. He's going to get his Cobra package. He's estimating his income between $80,000 and $100,000 for this current calendar year. He might pick up a small consulting job. So we're just kind of estimating that income. His Cobra package is going to cost about $1,200 a month, but they have a very low deductibles, like $3,500. So then, to me, that's pretty affordable for them. But we then went into the marketplace and to see what he would qualify for an income of about $100,000 for a couple, and he was 58 and she was 57. They're going to qualify for over $1,000 of advanced tax credit. So that reduces the retail premium of that plan by $1,000. So the lowest cost plan for that couple was going to be about $450 a month, which is a lot less, but the deductible was $9,100.
Ooh.
Okay, so a big difference. The other difference between the Cobra package and the marketplace plan, besides the deductible, the premium, the network. He is currently in a broad nationwide network. Now they plan to do some traveling now that they're retired. So that's a concern. If you travel, what happens to you if something happens outside of the local area? The marketplace plans that you buy through healthcare.gov, they're all localized networks. They're called exclusive provider organizations, or EPO, which means there's no out-of-network coverage except for emergency. So if you want to get a second opinion, maybe at MD Anderson, or you have a house in Florida, you're going to think about cost doesn't always come into the calculation. Because there's the networks, your providers that you're in, your deductible, all comes into the determination of whether you stay on the Cobra plan or you're going to go in the marketplace. And my recommendation for him, because he's not really quite sure what that consulting income is going to be, and he's familiar with his Cobra plan, I told him for this year to take the Cobra plan at least to the end of the year, get a feel where their income is going to be. It'll be less change than what they're used to, same providers that they currently have. And then during open enrollment, which is the same time every year in the marketplace, November 1 to January 15th, we can revisit. And then maybe once he has a better feel where his income is going to be per month, that we can then move into the marketplace, if that makes sense to him.
Yeah, that's really
Okay.
good. Yeah, thank you. So yeah, you would think on paper it would have been a no-brainer to take the
No-brainer.
$450, but with the higher deductible, the unknowns of the coverage and his income, I
Yeah.
really like what you did there. So good. Cory, do you have any questions on that before we switch gears a little bit?
I do.
Good.
Yes. So Caprice, thank you. The question that I have is, when someone really even just using the example that you just provided, when someone estimates what their income is going to be, and then they pay, the premiums are going to pay for their coverage, what happens if their income ends up being drastically different than what they anticipated, either higher or lower?
Good question. So again, when you go into the marketplace and you're estimating your income, it is an estimate. You do the best that you can. You look at what you filed in your tax return last year, what changes are occurring with that income. I always recommend that my clients talk to their financial advisors, because they know best of what the budget's going to be, what they're going to be doing on taxable gains, dividends, rollovers, whatever. I always tell them to first talk to them to get a better feel where that income is going to be. Then on the application, you put your income in, what you estimate. It comes back with this amount that you're going to qualify for subsidy. If at the end of the year, your income comes in higher than what you estimated, what happens is you file your tax return for the current calendar year. The IRS will actually reconcile your income that you file with them with what we put on the application. If you underestimate your income, you're going to owe a portion of the premium back. So say you should have, okay, again, back to that example I just gave you. We put in 100,000, he's qualifying for just over $1,000 a month. If his income, because we did look at this, we estimate, what if his income comes in at 120,000 versus 100,000? Does he have to give all that tax credit back to the government? No, just the difference. It's about between $100,000 and $120,000. The difference in the subsidy per month is about $100. So $100 per month. If it's 12 months that you underestimated, then you owe back $1,200 to the government. You don't owe it all back. If, on the other hand, your income comes in less than what you estimated, then the government could owe you money back because your subsidy should have been higher than what we estimated. Okay.
Got it.
So you get a refund at the end of the year.
Yeah, good luck getting that back.
The
Just
other
kidding.
thing is, as your situation changes, so say that couple that's now retired, but he's going to take a part-time job. He's bored. He wants to do something with his time. We estimated his income. I can go back into the application and update that income at that present time. So then his subsidy will be adjusted for the next month for the rest of the year. So actually, the government really wants you to update your income as your situation changes. Don't really wait till the end till you file your taxes. They want their money.
Got it. You know, another issue that we run into is we've been doing a lot of Roth conversions, right? So we'll take money out of an IRA, move it into a Roth, which creates taxable income. So I think what I'm hearing then is when we do that, we need to coordinate with you if a client is on the ACA and say, hey, you know, we've had an increase in income. This might not have been budgeted in or forecasted when you guys enrolled for this, but the good news is they could redo it, right, and adjust it accordingly. And I want to encourage clients, like you just mentioned, like if that particular in this scenario, if that client made 120,000, but they were consulting and enjoying what they were doing, in my opinion, $100 a month they shouldn't be upset about that, right? It's an adjustment in the plan. I think people really get caught up on that for some reason. They hate paying Caprice. You run into this, a penny more for their insurance. And it's like, look, you know, you made 20 or more grand. So you're still ahead here. Or we did a Roth conversion and that's going to save you thousands of dollars in estimated taxes down the road when you get older. And so I think clients that need to understand that we're trying to juggle it for them. And ultimately we're looking out for certainly want to pay as low as we can now, but we're looking out for their long-term plan when we're doing some of these.
And I do like your approach, Jake. that you do a team approach. And again, as I already mentioned, I really recommend before I do an application to talk to the financial advisor and then their accountants, so they can, I mean, really, to be honest, it's really a game. And if that couple that's going on retiring now, and I'm recommending they do Cobra, maybe they want to do some rollovers this year.
Right.
Pay the taxes now, whatever, and then next year go into the marketplace. And you have some clients that you've done this for that now are living off tax-free income through the Roth IRAs. And therefore, they're paying very little for their health insurance because they're not claiming that income because they've already paid taxes on it. So you need to look at those tax strategies. So
yeah, that's good. Thank you. And that's a big part of what we do is that we've invested heavily in tax planning software so we can run this analysis for our clients and show them how it projects out. And again, with your help, Caprice, on weighing the pros and cons of
the one thing I want to mention, though, in Missouri, you got to watch this. In Missouri, they expanded the Medicaid program. So that means if you're claiming income over 150% of the federal poverty level, you're going to end up on the Medicaid program versus healthcare.gov. So that means, for example, you're an individual or a couple. If you're going to claim income under $25,000 a year, you're not going to qualify for advanced tax credits. You're going to go through the Medicaid program. So you got to watch that. Again, back to your advisor to work on that. But I know a lot of clients don't want to go through the Medicaid program.
Right. We don't want to keep it too low then, is what
you don't want to keep it too low. So I usually say try to keep about $26,000, $27,000, $30,000 if you can.
That's good. That's good advice. That makes sense.
Higher, but not lower.
Right.
Kansas, you don't have the same problem. In Kansas, they didn't expand the Medicaid program, so your income can be lower. As an individual, you're looking at $14,000, which is the federal poverty level. If you're under that, you don't qualify for any tax credits. And as a couple of two, it's $19,500. Okay.
Got it.
It's a little bit different. Okay.
Good. So let's switch gears to Medicare then. So let's say we have a couple that's 65 or 70 or whatever. So what are some things that and I know Medicare has a ton of different parts, but what are some maybe common questions that you're getting right now or some things that people need to know?
I just had one the other night. Now, we're just talking about the marketplace and getting subsidies, right? A lot of people qualify for a lot of advanced tax credits. They might be paying maybe $6,400 a month for their insurance. And all of a sudden, they're turning 65. One of the questions do I get? Do I have to go into the Medicare program versus staying in the marketplace? My recommend strongly is don't stay in the marketplace because you're going to lose that advanced tax credit. So that $64 a month plan is now going to be over $1,000. You're going to want to enroll into Medicare when you're eligible, which is turning 65 for most people, unless you've been on long-term disability for 24 months. Okay. So that just happened the other night. She doesn't want to go in the Medicare because Medicare Part B is going to cost her $164, twice as what she's now paying for her marketplace plan.
Right.
So that's a very common question.
Good,
Another question I often get, a lot of people today are working longer than they have in the past. So they're working past 65. Okay. So one of the questions is, do I have to enroll into Medicare if I'm still working or I'm on my spouse's employer plan? Right? No, you don't have to enroll into Medicare as long as that employer plan that you're on has more than 19 full-time employees. If that employer has 19 or more full-time employees, then that employer plan is considered to be the primary insurance. And therefore, you don't want to enroll into especially Medicare Part B. Medicare Part B is the medical insurance. Medicare Part B has a monthly premium. Base premium is $164.90 or higher, depending on household income. So if you're going to be on your spouse's plan or you're still working, I would recommend again, it's another situation. You need to review it because if you're on an employer plan and it's costing you $400 or $500 a month and you have a high deductible with that employer plan, I'd definitely be looking at possibly going to Medicare. You don't have to, but it might be the more affordable option for you. Okay.
Right. That's what we suggest too, is that if they're still working and they're 65, let's at least look at it
Look at
and
it.
weigh the difference. Right. But you're right. A lot of people don't want to switch because they're used to it and they're comfortable. But again,
Yeah.
that's why you're here, is to help weigh those options for them.
Weigh those options, right?
Yeah. Cory, what do you have? Do you have any questions, Cory, to chime in with Caprice?
Yeah,
Medicare?
I'm just curious, Caprice. I mean, my understanding over the last several years has been that for at least for the clients that we work with at Falcon Wealth Advisors, for a lot of people, their healthcare costs have ultimately gone down when they moved on to Medicare. With all of the changes to the Affordable Care Act over the last few years, has that flipped some? Like, are there? Presumably, there's more examples like you just described, but is it still common that people's health insurance costs, broadly speaking, are less on Medicare than they are on the private marketplace?
Definitely are. My husband's going to Medicare in a few months, and I will be in another year, and I can't wait because I just did our taxes, and I estimated our insurance with our dental and our vision and our out-of-pocket and prescription coverage and premiums. It was about $14,000 for just my husband and I, because I get to claim it because I self-employed. So I write everything off, but that's what it was. If I go into Medicare, I cut it in about half.
Wow.
So, but again, it's always situational.
Yep.
Because
Right.
if you're a high income person and say you're claiming $500,000 adjusted gross income per year for you and your wife, you're going to have this income rate adjustment put on your Medicare Part B, and now you're going to be paying each of you over $500 a month for your Medicare Part B. And then you might go on a supplement. That's going to cost you each another $120, $150 a month. And then you have your drug plan, and then you have dental and vision. So again, it's situational. But for most people, going on to Medicare will be the more affordable option, unless you do qualify, like that example, that lady's not paying very much for her health insurance. Especially today, more and more people are going on the Medicare Advantage plans. In the Advantage plans, most of them have, so an Advantage plan is you're replacing original Medicare. Instead of getting your Medicare hospital medical benefits that you're entitled to from the federal government, you're replacing it and having an insurance company manage those benefits. You still got to pay for Part B, but the actual plan that you enroll into, most of them have a zero premium plan. And unlike the under 65 marketplace, you don't see $9,100 deductibles. Most of the Advantage plans have zero deductibles. You just have co-pays for the different things, and your max out of pocket is less. So then end up costing less for that individual. Okay.
Yeah, that's good. That's good. So you mentioned in the beginning that these consultations are complimentary, that you don't charge for them. So how, Caprice, we know you got to get paid. So how do you get compensated for your time and your advice?
My husband would not let me do this if I did not get paid. But I get paid commission through the carriers. And so if I enroll somebody, the insurance company pays me. And if, to be honest, if I consult now and nothing comes out of it, they keep my contact information, and 2 years later, they reach back out to me. It's a long-term kind of relationship that I have. And usually once I have my clients, they usually stay with me, and then you get residual income. So it's great.
Yeah, that's good. But do you get compensated for helping people with the Affordable Care Act at all, or no?
I do.
Oh, you do? Good. Okay, good.
Yeah.
Because there's a lot of nuance there. And so we certainly want you to get paid for your time.
I do. And I do. And to be honest, I do get paid commission through every type of plan that I sell. But just to let you know, most times in the marketplace, I'll usually put people in higher deductible plans, because cost is still something you want to be looking at.
Of course.
And usually I end up putting them into bronze level plans unless they're going to have a major medical event coming up. And then I will bundle it with secondary policies, accident plans, critical illness policies, hospital indemnity. There's things you can do to bundle with the major medical plan to keep the rates way down. or a lot less, plus fill the gaps. So you don't have to worry about that $9,100 deductible if you went out and on a bike and you fell off and broke an arm or something. Then you have an accident plan that pay that deductible for you.
Got it.
Yeah.
Good.
So-
Good. Yeah,
Good.
that's good. Good. Perfect. Well, I know we're winding down on time here. Are there any final tips or bits of information you want to share with our audience today?
I just always think it's best to do your due diligence before you make any decision. Don't be afraid to use advisors like myself. We're here to consult with you to make sure you know your options so you can make the best decision for you and your family. Okay. And it's
Yeah.
something that you review on a yearly basis because situations change. Your healthcare needs change, your prescription drugs change, the insurance plans change. Always new options coming out all the time.
Yeah,
So
that's good. Yeah, thank you. That's really good point. And certainly, if any of our clients or viewers want Caprice's info, simply send me an email, jake@falconwealthadvisors.com, or Cory at falconwealthadvisors.com, and we're happy to connect you directly with Caprice. So thank you again. We're recording this midweek. Caprice, you got any big plans for the weekend or anything coming up?
maybe some pickleball.
Nice.
I
Yeah.
do play a lot of pickleball, I have to admit, down here.
Good. Good. Well, if you're back in October, I don't know if you'll
I
be
will
here.
be.
Well, we will need to have you out at our pickleball event. We've got a Falcon
Oh,
Wealth
I would
Advisors.
love that.
Good.
Thank you.
Well, we'll make sure you get an invite and have fun.
Great.
Thank you
Oh.
as always for joining us, and thank
thank
you all for
you.
tuning in.
Okay. Thank you.
Thanks,
Have a
Caprice.
great
Thanks.
day.
You too.
Bye.
Thank you. Bye.
Thank you for listening to Upticks. Click the subscribe button to be notified when new episodes become available. Also, be sure to visit our website, falconwealthadvisors.com, and click the Contact Us button if you'd like to meet with Jake and his team.